So I have a lovely young lady. She was involved in a motor vehicle accident, head on. Undergone numerous facial operations, 8 years of surgery, over 42 operations.
Oh, wow.
She's about to lose her eye.
Why? Because of exposure conjunctivitis?
Yeah.
Really? Wow.
Wow, this is a big, big problem.
I'm unable to fully close my left eye. It's dry, it's red all the time, it's irritated.
Wow, this beautiful young woman is dealing with a really, really big problem. She's had 42 facial surgeries, and you can see that her eye on one side is much higher than the eye on the other. Let's learn a little bit more about what happened to her, and I'll give you my impression of why this happened the way that it did.
I was in a pretty severe car accident when I was 13, and that left me with this.
So it looks like she had very severe facial trauma. I've dealt with a lot of facial trauma, especially early on in my career and when I was in my residency training. And we would see patients who had been in major car accidents with a number of the bones in their face completely shattered. Now, the orbit is another name for your eye socket, and it looks like on her left side, the right side of the TV screen, she had a break in that eye socket, causing it to essentially be too low. So the eyeball on the one side is being held too low compared to the other side. The major issue that she's dealing with here, though, is that if you can't close your eye can get dried out, you can get corneal abrasions and dryness, infections, and you could eventually even lose that eye.
Before the accident, I loved basically any and everything that you could do outside. And then after the accident, there's just so much that I'm not capable of doing.
So what are some activities that you can't do if your eye won't close? Well, the first thing I think about is swimming. If you swim and your eye won't close, especially if it's in not the cleanest water, then you can get major eye irritations and infections afterwards. And she also has to worry about any type of contact sports. If she gets a scratch on her eye, now she can get damage to the actual globe, the eyeball, versus, let's say, a scratch on the actual eyelid.
The biggest issue with my left eye is that because it hasn't shut in 8 years, the cornea is drying out.
And that is a major problem. Now, why won't her eye close? Well, without obviously examining her, I can't tell you 100%, but I think what's going on is that the eyeball itself is sitting, once again, fairly low on one side compared to the other. Because it's sitting low, the eyelid may not be long enough to actually close the eye. The other part of it is that the lower eyelid also plays a part in the eye closure, and that part of the eyelid appears to be quite scarred in. So you get in a situation where the upper eyelid is not long enough to fully close the eye, and then the lower eyelid has been scarred open. There you go, the eye won't close.
I went on vacation with my friend, and this person went down the wrong side of the interstate, hitting us head on.
What happened to the driver?
She got killed on impact.
I treated a lot of trauma patients throughout my residency training, and this was something we saw so often. Now, I don't know in her situation if there was a drunk driver involved, but quite often with these big car accidents, there are drunk drivers involved. And the crazy thing is that usually the survivors of these accidents are the drunk drivers. They're not the people who are sober, who basically are victims. And the reason why is because if somebody is so drunk and they're just swerving all around the place, they don't really react naturally. So they get in a car accident and they just kind of go with the flow. Whereas somebody who's lucid, who's not drunk, and they're taken by surprise, what do? You tense up, and that tensing basically causes you to sometimes get injured more than if you were nice and loosey-goosey like the drunk driver.
Where'd you learn to drive like that? Grand Theft Auto!
I tell you, with all the accidents that we saw in the trauma bay, a huge percentage of them involved drunk driving.
Okay, so we have a little scar there in between, but that's not
all
bad.
skin graft, isn't it?
That looks like a laceration. That's all skin graft here. I'd love to see her get more closure here.
So apparently she had loss of possibly portion of her eyelid, and they put a skin graft there to try to make up for it. Now, one thing that can be done to lengthen that lid is to put a skin graft on it. You can make an incision, open the tissue up, and then put a graft there, and that will essentially act as a spacer. That's what can be done if somebody undergoes blepharoplasty surgery, an upper eyelid lift, and too much skin is removed. One of the main risks of blepharoplasty, if somebody's over-aggressive with the operation, is that you can remove so much skin that the patient can't close their eye. The treatment of that is placement of a skin graft as a spacer to cause that eyelid to close more.
So we took a palate graft from the roof of the mouth, which is a graft that would be placed in the inside of the lid to help push the lid up.
So how do you reconstruct this eyelid? Well, once again, the eye itself is sitting too low, and so you can either break the bones and try to reset them higher, which I think would be very difficult in her situation because she's probably just missing tissue there, or you can take the floor, essentially, of the orbit, which is what the eyeball sits on, and if you can put a graft there, you can cause that floor to be a little elevated. It's kind of like putting a booster seat underneath the eyeball, causing it to sit higher. That will allow the eyelid to close a bit better, but the main issue with that is what do you do with that eyelid that's pulling down? They don't show it in this video, but what he tried to do is actually release that to see if that eyelid would close up a bit better. Another thing you can do is put a skin graft down there.
Now, since the inside of the eye is fixed, the repositioning of the two corners are fixed, now what we're missing is skin.
So that's where the skin graft can come from. Now normally if you're missing skin down here, you can try to rotate tissue over to help support it, but once again, a full thickness skin graft may be another option here.
So all three of us are operating. Dr. Frederick is finishing the neck scar revision. Dr. Masri is placing the skin graft in the left eye, and I'm on the right side performing a septoplasty.
When people break their nose in trauma like this, you can also break the septum. So you can break the outer nasal bones, but the septum, which is basically the bone and cartilage that is in between the nasal bones. And if that cartilage and bone gets broken off to the side, that can cause a person to not be able to breathe through that nostril. So a septoplasty is an operation usually where you actually remove a cartilaginous portion of the septum, leaving enough there to act as support for the nose to cause them essentially to be able to breathe much better. However, if you take too much of the septum out, your nose can actually collapse, giving you a real flat nose. Another cause of nasal collapse is snorting too much coke. Doing a lot of coke can cause the blood vessels that go to the septum to become constricted. Eventually, that septum cartilage actually dies off and the nose can actually collapse completely.
Since the surgery, everything about my face is just so much better. There's symmetry that is happening. My left eye isn't constantly leaking, and I can breathe.
What a wonderful and completely complicated reconstruction that she had. This is a really, really tough situation, and for them to get the improvement that they were able to get, I think is really, really impressive. Well, if you thought this transformation was big, there are some transformations on Botched that are even a lot more impressive than this. Take a peek at this video where I react to a few of the most amazing transformations on the show Botched. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.
She only has eyes